Hello. Based upon your MRI and your symptoms, we've recommended that you consider surgery. Now, surgery consists of a lot of different steps, and it's very important that you understand the steps that are involved. First is simply the insurance. So after we've recommended the surgery for you, we will go to your insurance company and get the approvals that are required for your insurance. Second, we will be collecting all of your films that are necessary for the surgery. Third, it's very helpful for us to have a very complete list of all the medications that you are on. After this process has taken place, we want to make sure that you're safe for surgery. And what we do is what is called preoperative testing. So we want to test your heart through an EKG. We want to look at your chest through a chest x-ray, and we want to do blood work. This is so important for us to make sure that you can get through the surgery safely. And I ask you please to go at the time that we ask you to go, simply because we want to make sure that we have that data in advance so we can check it out and make any corrections that are necessary. Prior to the day of surgery, there are some things that you need to talk about. So the day before surgery, you will get a call from us that will tell you what time your surgery will be the following morning. And in addition, most likely you will have to stop eating and drinking after midnight. In most cases, you will be taking all the medications that you normally take on the morning of surgery with a very simple sip of water. The medications that you have to be careful about are, one, all those medications that thin your blood, such as Plavix, Coumadin, or high doses of aspirin. And in those cases, we will tell you when to stop. The other drugs that you have to be careful about is if you're taking any medications, particularly for diabetes, because we might have to adjust some things the night before the surgery. Now, this surgery is what we call elective surgery. It is not an emergency. So we want to make sure that you're as healthy as possible. We also want to make sure that there's no bites or ticks or anything on your skin that might increase the risk of infection. So coming up to the days of surgery, if you're not feeling good, or if you got a cold, or if you fell down, or if you scraped your knee, any of these things, you must inform us. The morning of surgery, I will see you in what is called the preoperative area. We'll talk again with yourself and any family members that might have some last-minute questions. And then, of course, after surgery, I will call the family members that you would like me to call so that they are well aware of what's going on. I just want to talk a little bit about the length of surgery because it often creates a little bit of worry in family members that I want to alleviate. First, the setup of a patient in the operating room, putting them to sleep and waking them up, can sometimes take almost up to an hour and a half. So even for a simple surgery that I might think might take only an hour or an hour and a half, if you add that additional time, we're almost up to 3 hours. So keep this in mind when you're thinking about how long a particular surgery may take. Second, typically the patients are in the recovery room for almost up to 2 hours. And unfortunately, in the recovery room, the family members are not permitted. So if we think that a surgery is going to take potentially 4 hours, we would add an hour and a half, so that means 5.5 hours for the actual surgical time in and out of the room, and then another 2 hours in the recovery room. So it's almost roughly 7 hours before, as family members, you're able to see a patient. I'm happy to call after the surgery is done, but sometimes it may be easier and maybe less stressful to go home and to come back 7 to 8 hours after the surgery to see your family member. I hope this helps. Thanks.